It was actually Dr. Reiter. He was recommended because I tore my ACL and meniscus while at work. So he was recommended here by my work, and I was kind of skeptical at first, but once I met him, I was like, no problem, he's good to go. He was great. He was very down to earth, and he explained the whole process, which I had my other knee done, and he did a much better job of explaining everything than my other surgeon did. So, and basically the new techniques and why we were doing this versus that, and women versus men, and he was very good at explaining it, I guess I should say. Made me feel very comfortable. I'm getting there. Not 100% yet, but I'm still doing physical therapy, but getting there, getting stronger. No more pain, so that's a plus. And hopefully going back to work in the next month or so. It feels way better than last month, and then last month was better than the month before. Obviously, it's major surgery, so right after is kind of a shock to the body. But the best thing is the availability of the staff here just to ask questions. And the great thing is, especially in PT, when something's not going as well as I think, even though it's on track, the doctor's right here. They just run over and say, hey, is this something that should be happening? Is this not? And then it's just very reassuring the whole way that, yes, it's not exactly how you want it to happen, but this is the body's way of healing, the process, and he explains it very well. And it's just very reassuring. Some of those times when you're in pain and you're not sure and you're swelling, you're doubting everything, and it's nice to have them right here reassuring you, holding your hand, so to speak, the whole way. For Dr. Reiter himself, he's just very personable. I like how he's very down to earth. He takes the time. I did have kind of some pain issues, and he went, hold on a second. He went and got the model, and he really sat down, took the time with me. He was like, this is exactly what's happening. This is why it's happening. On your MRI, it showed this and that. And that's just reassuring to be like, okay, maybe this isn't the way I wanted it to heal, but this is why I'm healing this way. And it just calmed me down, like, okay, well, this is the process. And he just took the time to show me. And sometimes just that personal ability to be able to sit down with your patient, especially in this world when you're just a number sometimes, it was reassuring for me. I was kind of skeptical at first, I'd tell him, be honest. But as soon as I stepped in the room and he explained everything to me and he started talking about the surgery, the science behind it, why we do it this way for women and this way for men, and my age and everything. I was like, okay, this guy knows what he's talking about. I was like, it made me feel very comfortable with going with him, and I'm very happy that I did. So I would recommend him to anybody.